Welcome to the Northside podcast, created to help you discover real life. You can tune in each week on Facebook or Church Online to watch live, or you can listen throughout the week on Spotify or Apple Podcasts. Now, let's jump into this week's episode. Well, hey everybody, and thanks for tuning in to the Northside podcast this week. My name is Worth, and today I am joined by our pastor, Kenny Chin.
How's everybody out there? Good to see y'all.
And today, as you can see, we have two very special guests with us today. First, we have Abby Ritter.
Hello.
Abby, introduce yourself. Tell us what you do.
Okay, I'm Abby Ritter. I'm a registered respiratory therapist at New Hanover Regional Medical Center.
That's a mouthful.
That is.
That's difficult to say, for sure. We're also joined by Pamela Firetti. Pam, would you introduce yourself?
Yes. I am a public health epidemiologist at New Hanover Regional Medical Center also. I have a nursing background, was a trauma neurointensive care critical care nurse doing bedside nursing, went back to graduate school and am a public health epidemiologist now.
I'm just amazed. We are
I don't even know what that is.
We're on a different level.
Okay, so.
Are we qualified to be sitting here right now?
I don't think so, which is the reason we brought them in.
Well, before
I was just put right under the table right then. You know what I mean? So.
Well, before we jump into our conversation tonight, let's talk about this morning. This morning we had our first move to kind of back to our normal service times, 8, 9:30, and 11, and just had incredible engagement, incredible numbers from this morning. I just want to share a little bit with you guys. We had a total of 4,646 people that were reached this morning with 2,059 unique viewers, 729 engagements, 402 comments, and 68 shares. So you guys keep up the incredible work with those shares, because those numbers are just humongous.
Yeah, one of the things that I talked about this morning too was the fact that I feel like I'm hungry for fellowship. I don't know if you guys are or not, but I'm pretty tired of preaching to empty chairs and camera lenses. So I always have the staff in there, and the staff but they're always busy. They got things to do, and all of our volunteers, the reason they're here is that they're volunteering. They're doing stuff. And then they do sit down and watch the service, but my main focus when I'm preaching is to look at that camera. I've had to learn to preach to the camera. So it's been a little challenging, but I'm hungry for some fellowship, and so what I've decided to do was open it up and allow some small groups to come in. And we're going to start with 2 or 3 just to find out how that works, because we want to make sure that we get a little bit some dry runs through to figure out how do we sanitize the place, how do we take care when people are coming through, and things like that. We would ask whenever small groups come in that you wear your masks when you come in. Once you get in place and we get separated to the extent that we need to, then you can take them off. But while we're coming in, while we're going out, we know we're going to try to take care of making sure that we maintain all the social distancing and the cleanliness procedures, and then we will disinfect the place after everybody leaves. So I think it opens up the door for us to have some pretty good fellowship. So I hope that you can talk to Joe Easterling, you can talk to Elliot Medlin. They'll set that up, and I look forward to seeing you. Then I'll preach more to the people than the camera.
It was nice to have some people in the room today, just from leading. I mean, I'm sure you guys have probably seen on camera or heard us talk about when we're leading on a Sunday, we have a TV up there at right where the camera sits, so we can see as you guys comment, as you guys start to, hit the like button, we can see that, and it really is a good mindset for us to be able to say, okay, there's people that we're reaching. However, it pales in comparison to having actual people in the room, and though it was just a very small amount today, seeing some of the staff in there and just seeing their hands raised in worship. At one point you said something and Mike let out this laugh that literally picked up in your microphone some 50 feet away. It was nice.
I tell you, it's cool to see the
engagement.
little hearts coming up, but every now and then you'll see that little frowny face.
All right, can I say, all right, Kimber, if you're watching, I just want to say this. All right, so she called me out this morning. So I was setting up the TV this morning, and I'm sizing it so he can see the comments, and I can see it wasn't a joke on your eyes. I was sizing it up so we could see everything, and I accidentally hit the Northside frown face, and that was from Northside. And so Kimber sends this text, and she's like, "Who in the world is sending this angry face from Northside?" That was me. I apologize if anybody was wondering. That was definitely me.
Was that subliminal?
It might have been.
I
No, it
hope
was a
not.
great morning. That was
It
definitely
was a
not
great
subliminal.
morning.
That
Worship
was
was awesome this morning. Loved it.
just an incredible morning. You guys will also notice we are in a different spot here tonight. You are joining us from our new podcast studio. It's a work in progress. We are actually upstairs in the Life Center offices, and we built this to really try to provide for you guys the very best content that we can every week. You'll notice from the very beginning we've got some plexiglass set up.
Yes, we do. We put some plexiglass up here because we're trying to make sure that we keep everybody safe. And we got a couple of healthcare professionals with us today, and we wanted to make sure that all of the guidelines are taken care of so that that there will be no cross-contamination, no problems with anything like that. I didn't want worth spitting on you or something. So it was important for us to put in the proper safety measures, and it makes it, you might not be able to see it on camera, but we're all kind of barriered off, so we're safe. That's a good thing.
Well, I hope you guys enjoyed last week's conversation with Kim and Anita. I know that there were a lot of parents who were definitely impacted by that conversation, who needed for that conversation to happen. And one thing that I noticed that was just really cool was seeing, as you go through the comments back on that video, how it wasn't just us answering or Kim and Anita answering, but parents started answering other parents. Parents who homeschool started saying, hey, I can help. I can be a resource if you need. Parents who might have some insight or on any of these areas just started helping each other. And so we thought, how can we continue that conversation? Obviously, we needed to move on with our podcast. We wanted to keep it at an hour. But how can we continue that conversation? So we have decided, and launching tonight is a Facebook group that we're calling Parent Resources for School Reopening. This is going to be a place where parents can go to ask questions, to connect with local teachers that are in our church community and beyond, and just be able to kind of be a resource, be able to get resources. And so I'm hoping that this will be something that really extends beyond the walls of our church, that our community, who is in such a big need for some of these answers and some of this conversation, that we're going to be able to provide that. So.
That's all. But how would you be a part of the group, though? I mean, it's one thing to go look at it, but how do you get into it?
So to get into it, it's going to be a public group. So there's going to be no joining necessary to be a part. Now, if you want notifications and all that, you definitely are going to want to hit the join group. But all you got to do is go to Facebook, type in Parent Resources for School Reopening. And once you do that, it's going to pop up, and you can go ahead and join that group. And once you're a part of the group, you can be one of those people. I'm in so many Facebook groups, and I barely post anything. I just like to read stuff. I like to go through and read as people are talking about different things and stuff like that. So you can be one of those people, and that's okay. However, if you are someone who just has a ton, I know my wife is one. We have 3 kids starting school, kind of wondering what to do. And I got home Sunday, and she's got a book with like 25 different questions just ready to ask somebody. And so, if you're someone like that, this is the place for you. This is the place for you to go in and ask some of those questions. And then there were so many teachers and parents who were like, I'd love to help.
What's important about this group, though, for everybody to understand, is it's an unmoderated group. So it's not like we're sitting on there waiting for questions to come in. It is a Facebook group where you can go put a question on there. When people drop in and drop out, they'll try to answer your questions as much as possible, but it's not a moderated group. So don't sit there waiting for an answer to come straight back, but there will be some answers that are on there. We'll peruse that group, but, I don't know if you want my answers. I don't have a kid in school anymore, and I'm not but both Kim and Anita last week blew me away with questions I never even thought about. Like teaching your child to wear a mask right now.
That was genius.
Right now, before they have to go to school. I never thought about that, but on that first day of school, can you imagine? It's going to be a fiasco.
I want to give a shout out too to somebody. Beverly Leonard just said, hey there in the comments 1 minute ago. Miss Beverly, we love you. Thank you for being a part of the conversation. You weren't on the video, but you were a part of the comments last week.
Yes, she
and
was.
So I'm sure you guys will see Miss Beverly in that Facebook group because she has a spirit to help, and I know that she is ready to jump in there and be a resource. So thank you, Miss Beverly, for everything that you do. So
yeah, I don't know if you know this about Beverly, but she's a prayer warrior.
She is. And
she prays for me all the time, sends me emails, what's going on this week, how can I help you, what can I do for you? And so, oftentimes I get credit for things that it's not even somebody else ought to get credit. You know what I mean? I mean, they really should. So people hold me up all the time. David, Martin, and Beverly are probably 2 of my great prayer warriors that always are praying for me, so I appreciate that.
Well, guys, we are really excited for that Facebook group to just continue the conversation and really to reach out to our community and really help our parents. But tonight we are excited for the conversation that we are having right here. So first, let me say, Abby and Pam, thank you guys for being here tonight. I know that it takes a lot of courage when you walk in and you see the cameras and the microphones and the headphones, and it can be a scary thing, but both of you are really stepping out, and I want to say that I appreciate it, but I also want to say that I appreciate what you do day in and day out, what you do for our community, what you do for everyone who comes into your path. And so just on behalf of our church, on behalf of our community, I just want to say thank you.
Amen.
For everything you guys do.
Yeah, you guys are some of our heroes, and you really are heroes. You might not feel that way, but you really are heroes, and we appreciate that. I do want to say this before we get started in this conversation, though, because we are talking about the pandemic and some of the details of it, and people are concerned about their health and what's going on. I need to be sure that people understand. They probably know this. I mean, we have a doctor on staff, but it's not me. It's Joe. But Joe Easterling is not one of those doctors that does anything for anybody. Isn't that how we put it? I think we always keep saying that about Joe. He's a doctor, but he just doesn't help people.
There it is.
Not in a medical way. Joe's an amazing guy. But nonetheless, we're not doctors. We're not giving medical advice. We're not telling you guys, hey, here's what you do or here's how you do it. If you have medical issues, medical problems, you need to see your doctor. You do not need to say, well, Pastor Kenny said, or anybody on this panel said that. That's not why we're here tonight. So we are not offering up any kind of medical advice. And we are going to disclaim that tonight, and we're going to ask you to hold us harmless for anything that is said this evening, okay? That is really, really important. And I must say that both for you, Pamela and Abby, both, to be able to come here tonight is wonderful for us. But at the same time, there are similar challenges. You're in the medical community. You work for New Hanover County or New Hanover Regional Medical Center. And I think you ought to share with us what you are not here for, what you cannot do or cannot say, that because we don't want you doing anything that will get you in trouble, you know. Pamela?
Yeah. So yes, we do work for New Hanover Regional. We disclaimer right out the gate. I'm not representing New Hanover Regional. What I voice or what I say, or my opinions, they're our medical opinions, but that we are not representing our employer during this time.
Okay.
I think Abby can say the same.
Yeah, I'd say the same thing. I'm not representing New Hanover Regional Medical Center. I'm representing my experiences working in the field and with the disease and with people.
Yeah.
Yeah.
We're all both proud employees of New Hanover Regional Medical
absolutely.
Center. No question about that.
Love it.
But their comments are their own personal comments, and we just want to make sure that make that clear on the very onset of this.
Yep.
All right, so Abby, I really want to ask this question to both of you guys, but now specifically for Abby. Some people may not know. Now, my whole family are nurses, my mom, my aunt, so I'm familiar with a lot of these terms, but some people might not be. What is a respiratory therapist? What do you do in that role?
Okay. Well, I've been doing it 30 years, and I've to this day have trouble explaining it.
Okay.
Everybody thinks we're nurses. We do work alongside the nurses, but we specialize in cardiopulmonary, which is the heart lung. We can do a wide range of things, from working with asthmatics, your COPDers, doing breathing treatments, to ventilator patients that are on the ventilators for a number of reasons, whether it's surgery, trauma, their lung condition. We also do sleep studies, pulmonary function testing. We do home health care. We do a wide range of things, but we specifically cardiopulmonary,
Okay.
specializing in that.
Yeah.
And Pamela, public health epidemiologist.
Like I said, I was a nurse, graduated in the early 90s. Of course, I was a baby when I graduated. No, and so I immediately went to work at New Hanover Regional, did med-surg, then went down to critical care, and then left New Hanover Regional and did public health. And had a love for communicable disease and infectious disease at that time. I actually was a school nurse at Trask Middle School, which was very interesting because I used to go to that school
Me
in middle
too.
school
Look at
when it was
that.
Trask Junior High School.
It was Trask Middle when I went,
Yeah.
but
Feels
Well,
weird
I'm a
going
lot
back,
older.
doesn't it?
Yes. And so when Reed, I have a son, a 19-year-old. When he was a toddler, I went back to school at UNC Chapel Hill, and upon graduation, got the job at New Hanover Regional again as a public health epidemiologist. And my job at New Hanover is it is a North Carolina Department of Public Health funded position. DPH has 7 positions that they put in 7 of the largest hospitals, funded through CDC, bioterrorism, and preparedness funds. So I have 6 other colleagues in the other 6 largest hospitals in the state. And so my position does disease surveillance or syndromic surveillance. I do bioterrorism detection and outbreak management. Communicable disease, I do all of the communicable disease reporting for New Hanover Regional and for
Okay, Worth, once again, we're leaving the room.
I was about to say I'm about to
That's a
just
mouthful.
we'll set it to that camera and just go. You
Yeah.
know,
But I
We're outta
can't-
here.
But I can't figure out how to get my.
I'm just like I play music. I
Questions
don't
on
know. Well, can I say
She needs help
Abby,
with her phone so she can see some questions on there.
Well, I'm going to help you in just a minute, but I'm going to tell you one of these first because this is really encouraging. Serena Bell just said when Irvin was in the hospital that you were such a huge blessing to them. She says she helped me understand what the doctors and nurses were saying, and she has been a constant help with a heart emoji.
Thank
So-
you. We love you.
yeah.
Well, you know,
And
every
Irvin.
time I go to
We
the
love the
hospital, which is not
bells.
as much as I used to, but when I do go out there, it seems like I always see you in the hallways or Carolyn Bell. I don't think I've ever seen you out there.
No, stuck
I'm not
my
in your
4 walls.
area, but we have a number of healthcare people in our church, and it's such a blessing to see them. And when I go in for, so I'm going to have eye surgery in a couple of weeks, just so I can see better. I don't have anything wrong with them, but I want to see better. And I got to go to Pender to do it. But Faith Perez is going to be my nurse to care for me. I guess that's what, I don't know exactly. But she's going to care for me whenever I go up there, which is an
Nice.
encouragement that there are people that you can count on and trust. When I had my back surgery, Danny Langston was my post-operative care person in there, and he helped me because I'm combative when I come out of being sedated. So I told Danny, I said, look, when I come out, don't get close because I'll punch you out. But if you'll just say, hey, Kenny, you had surgery, it's okay, I'll be fine. Don't be grabbing on me and hold me down. And the first voice I heard was Danny Langston. It was such an encouragement. You know.
I will say that with Serena making that comment, that's one of the things, we're not allowed to have visitors right now. And it's very frustrating for the families
Yeah.
outside of the walls of the hospital. And I just encourage them to know that we are taking care of them and trying to advocate for them. I know how I'd be if I had a loved one on the inside and couldn't get in. And yeah, so it's tough.
Aren't you grateful to have loving Christians that are in there ministering to people, all people, no matter who you are, all people, in a time of their great need?
Well, it's actually changed the role of the bedside nurse or the ancillary departments because with visitor restrictions, it does make bereavement for families very difficult. Where we encourage FaceTime and Skype, and but the nurse and the medical team are having to update, family members via phone, and it might not just be you as one family member, but the other 4 family members also. So, they're having to extend compassion on the phone versus being able to hug that family member at the bedside. And so as, holding the hand of the loved one as they pass or, having it on FaceTime while the family's able to watch them. It's made healthcare, it's really changed the face of healthcare in those moments. And two, even for the patient, it's different in the sense that I want my mama there,
Yeah,
I want my
absolutely.
husband there. And, they can't. They can't. Now we are starting to open visitation up a little more, and especially in those end of life situations.
Mm-hmm.
But it's challenging not only for the patient and the loved ones, but it's challenging for our medical staff too. You know, and I'll actually see when I'm doing surveillance documentation by the nurse where, you know, as the person passes, she's holding their hand. I mean, you can feel the love that she's actually documented, that, you know, she's played music for that.
Yeah.
So,
You know, I think that I want to roll this back a little bit if I can, because one of the things that we wanted to do, because everything has been so kind of pulled away, was to roll back to March or just before March, before we shut everything down, and healthcare prior to that, and then COVID hits, and all of healthcare changes, and there's such a change in perspective, a change in role play, there's a change in everything. So from an inside perspective, because honestly, nobody has one except for those of us who are on the inside. So from you guys' point of view, how have you changed? When here COVID hits, and then all of a sudden we don't know what's going on, and all these regimens have to change, your whole entire world changes. How did that affect you guys? How do you see that? Abby?
Okay.
Make sure you guys talk really close to your
Okay.
mics too. I heard a couple people say they having trouble
Okay.
hearing.
sorry.
Well,
That's okay.
And I hope I answer the question, but you know, when it first came about, we were scared. I was scared. I was thinking about my family. I was thinking about, my family. I've got a immunocompromised person living in my house, and got elderly parents, and I was thinking, I'm going to be front line right in there, and we don't know what the heck we're doing. And I was scared. A lot of my coworkers were scared, and it was a time of, what are my options here? Am I doing this, or am I retiring, or what am I doing? I think a lot of people really, I know the few people I know talked about that.
And our perspective was, we just assumed that that's what you do. You're supposed to do it, but I don't think we thought
Right. And
a lot about you guys.
we've done a lot of things. I mean, we've been through other viruses that we didn't know much about, but for some reason this one just seemed to be worse. But I decided that I was in it to win it, and fortunately the hospital, did step up with the PPE and supporting us that way. And now that we've been in it a little while, we know what to expect somewhat, and it's not as scary.
That's good. Still scary?
Still scary.
Still scary a little bit.
Yeah, but
Yeah.
I mean, we've been doing it a while, so.
Okay, so you would say then that COVID is it's not fake.
It's not fake. It is real. It is very real. People are sick in the hospital with it. Most people will recover from it, and won't get super sick. There are a small amount that will, and unfortunately, we're seeing those. And
Are there any indicators of the kind of people that are really going to get seriously sick from it, and the ones that maybe not?
What I'll say, and I know Pam has a lot more to say probably about it, is, obviously they're saying the immunocompromised, that if you already have, obesity, renal disease, diabetes, high blood pressure, your age plays a factor, those kind of things. Heart and lung. But they're getting sicker. And I think also the African American and Hispanic communities, I believe. So
Have they
that's what
traced
we're
out
seeing.
why? Do we know why? Pamela, do you know why?
Well, comorbidities, obviously, if you have heart and lung issues, you're at a higher risk. Immunocompromised, your system's already, depressed. As far as the migrant population and the African American population, research is still ongoing. There's so much that we do not know about this. Obviously, it's a novel virus. But for our migrant population, we're seeing a lot, based on their work, based on, gatherings, a lot work in plants, a lot work in construction. They're closer together.
Right.
we're seeing decreases in that population because of education and finding more about it, doing things like this plexiglass implants, and educating, providing them with personal protection of masks, rotating their breaks, making sure that we're educating when they're going to work instead of getting, all going in one van or in one truck. Making sure it's the same people that you're going in that van and not rotating shifts of that.
Would you say, when you say, the health risk of one person versus another, you had mentioned kind of those pre-existing, things that might be going on with them. Would you say that it's a higher risk of them catching the virus or becoming, very ill from the virus? Is there a difference, and kind of clarify what you mean there?
I would say being sicker from it, how it's going to affect your body. Certainly if you are immunocompromised, you're depressed, so your immune system is depressed. If you have heart and lung issues, then, the effects of the illness will be harsher on you.
And would you say that, the ability for someone to catch it, how contagious it is pretty standard across the board, that, everyone is kind of at the same risk of catching it, or would they not be?
If you don't have an answer, that's okay.
Well, I would say we are at the same risk to a point, but it's how much do you put yourself at risk too? How much are you out in the community? Are you washing your hands? Are you wearing your mask? Are you doing these things, socially distancing? So
it's also the viral load of what you're exposed to also. So how contagion is the person that you're exposed to? How long were you exposed to that person? So,
Okay.
But I would like to back up. You asked about the hospital and, what it was pre-COVID. So our hospitals have been very busy. Pre-COVID, we're a very high census. We have an overuse of our ED, so we have long wait times to get. So we were already maxed out, pre-COVID, and that's nationwide. And so COVID just put a different, layer on that. But I think if you go into the medical field, you're a loving, you're a caring person. You want to improve the life and the health of other people. And you also have to be able to work under pressure and be flexible. And so the stress of COVID, yes, it's put a toll on the emotional, the physical, the mental well-being of our staff. But for the most part, I think we're resilient. We are going to overcome it, and it's wonderful to see the entire facility come together to combat this. We have changed some things within our facility, visitor restrictions, halting non-elective surgeries or elective surgeries, and have made changes to decrease some census to allow for our COVID patients. But nurses and medical professionals, I think for the most part, they've stepped up.
Yeah,
but
they have.
But we are always preparing pre-COVID, and that's one thing that my position, the state has recognized that, and so we're always planning for something like this. We drill, we have protocols, we do weather-related mass casualty events. We're constantly preparing for something like this. And I actually think the Lord was preparing us for this exact event, because at the beginning of the middle of last year, we received a grant for 80 cappers, and she can go into actually what a capper is, but it's the space helmet that you use, so you don't have to use an N95, you actually wear a space helmet. So we received a grant, and it was actually to help with combat Ebola. And so we got 80 cappers in. We had the National Ebola Training Education Center come. We drilled with them on high-level PPE. We researched and purchased extra Xenex robots for disinfection. Our North Tower, you've driven by and you've seen our North Tower that's in the back of our facility. Well, it was scheduled to open, but then Hurricane Florence came through. We had a bunch of construction issues because of that, a bunch of damage. So we didn't open that. Well, now that we have COVID, we've been able to use those cappers for our medical team. So, they're not having to wear the N95 mask all day. They can rotate with the cappers. We're able to use the disinfection robots for enhanced disinfection, as well as turn our rooms over quicker. We're able to open up the North Tower to help decompress our main tower. So, we've turned entire units into COVID units. So, like our entire floors, we've made negative pressure rooms, so we can move some of our medicine patients now over to our North Tower. So, I think, like I said, I think the Lord was preparing us for this exact event with some of those things, and that's just a small example of things that have occurred like that.
Well, I would assume that both of you guys work a lot of hours. I know that you do. And it's been quite some time. I mean, it's been a complete, 4 or 5 months. And what do you do to refresh?
Well, I'll speak to that first because I'm
Okay.
part-time and I don't work a lot of hours. I'm just going to be honest. That's my choice. But our managers and bosses have been wonderful. We do have, a lot of staff that works more. We have travelers they've brought in for the bedside, and they help relieve us from the day in and day out too. And so for us, that's helped because you do get tired.
Yeah.
Even working part-time, you're going, wow. So.
Well, I think in Pamela's position, they don't have a replacement for you.
No.
No, I'm very able to be replaced, but right now it's just being in the command center. Our staff rely on us, and so as you know, science has changed, CDC has changed, so we're continuously having to stay ahead of that and following guidance, updating protocols, and really following the science to make sure our staff are safe. And so, yes, pulling a lot of hours, 12, have had 16-day hours, but haven't gotten that respite that you're speaking of yet, but it's coming. We will survive COVID. I come from a very close family. And
Yes, you do.
Yes. And so just being able to get that phone call and that encouragement, and my sister and my mom text me all the time praying for you, and do you need me to bring you something to eat? And so but that respite's coming.
Well, your sister said that she's glad to see you on here because it's the most she's seen you in weeks. So any way that we can help, anything else. Here's a question that I think a lot of people have. I took a picture at home of all of Terry's masks that and they're lined up everywhere, and all just kind of
Got one
flavors
for
and
each outfit.
colors and all kinds of stuff. All these masks that are out there, and I'm finding the comfortable ones.
Mm-hmm.
I like like made out of a neoprene type material, so it's really comfortable to
I have
wear.
so many masks. You just got to find the right one.
You do.
But here's the
But
question.
you have to clean them.
Yeah, here's the question. Do they really work?
Yes, they do.
That's
So,
The
so-
silence. I was like,
I
oh.
didn't know she was going to answer it, but yes, they do. And that is evidence-based medicine. So I don't understand where the general public argues against the effectiveness of masking. So, we've masked for respiratory diseases forever. We surgical mask, put surgical masks on, a patient with influenza in the hospital. Plus, we wear a mask on droplet precautions for patients in the hospital. We mask for TB. We mask for pertussis. We mask in surgery. So we have used masks.
Yeah.
For a
Well,
long
I
period.
wanted to ask that question because I think that where we're at is this is not just a medical crisis. This crisis happened to fall on an election year, as well as a few other things. And I think that I think I'm going to lay at the feet of the national media, because I really think that that's where the blame exists. But they're politicizing everything. And then, of course, it sort of washes over everything. And people get the idea that you're taking away my freedoms or things like that. And so then it gets kind of mixed up. And I think it's important for people to hear that there's a lot of political stuff going on, and I don't know that we're going to get past that until November the 4th. But even in the midst of all of that, to be assured that we're not trying to steal your freedoms away. What we are trying to do is to make sure that we can get this thing. We're trying to get the COVID away is what we're trying to do.
Right.
And if we all would take personal responsibility and responsibility for those that are around us and say this would help. And I just want to hear an inside view. Yes, masks work. No, they don't.
Well,
Well,
then let's step back and say how COVID is transmitted between people.
Okay.
So, one, it's a droplet and airborne disease. It's a respiratory infection. So, it spreads from the nose and mouth when you talk, you sneeze, or you cough. If you actually go in a doorway and you're looking outside and you cough and you sneeze, droplets, you can sometimes see them.
mm-hmm.
So those are droplets. But then you have airborne, and you can't see airborne. And so some particles of airborne, they're so small. And then the large ones of them, they're the ones that settle. So they settle within 6 feet. They can cover surfaces, tables. They're thought to die within a few hours. But then you have smaller ones that are longer lived. And so they're the ones that get carried in the air. Hence the word airborne. So you have a longer exposure to those when you're in a closed room. You're in there for greater than 15 minutes. If you just pop in that room, you're not going to be exposed.
Mm-hmm.
It's a long time exposures. And so, but those aren't thought with this disease to be as important in transmission as droplets. So wearing a mask will help prevent that person to person through exhaling or close contact with someone. And so it not only protects you from giving it to someone else, and we know, and we'll probably get to that, there is asymptomatic transmission. And so you may have COVID and not know it, and so you're able to spread it to someone else. But then it helps the source, and then it helps the host. It helps the person that's giving it, and a person from it getting in your nose and your mouth from that person.
So if it comes down to touching somebody, is that because more or less if you've coughed in your hand or something like that, that seems to be the problem?
Correct.
Okay. So it's not because I just touched you.
No.
Okay.
No. Now, again, so much is being learned about the virus,
Right.
and
At
so
least
it
right
could
now.
be on, your clothing. It's not going to live for long periods of time, but if you're not, if you don't have great hygienic practices, obviously those viral particles can remain on you longer. But washing your hands, wearing your mask, staying 6 feet, the 3 W's, wait, wash, and wear, wait, and wash.
Wear, wait, and wash.
Yes.
Okay.
That's easy to remember. Something else that made
That's
me
like www. It's like the whole, internet thing.
it made me almost laughed out loud into my mic. Mary Ruth said, "Click it or ticket, mask it or casket."
I've seen that.
Oh, I love that.
Okay. You got to find some humor in there somewhere.
Well,
love
the
that.
mentality has been that I hear, oh, well, I'm not wearing a mask. It's my freedom. And I do get that. I totally get that. But wear it for the person beside you. Come on, let's just do it. Let's just do
That's a small thing to do. Again, I think that the reason that there's such an offense to it is not, if this was just a health situation, I don't think it'd be a big deal. But we are in a very significant and serious attack on this nation for its democracy. Mm-hmm. And things like this are gateways. into other things. And I think that some of the stuff that's going on right now is fear mongering to find out just how much of our freedom can be taken from us on the basis of fear. And so people are they're pushing back by saying, well, I'm not going to do this. There's other ways to push back. And I think that unmasking is not the way to push back.
Well, again, it's proven. It's evidence-based. We utilize them in the hospital. Any hospital in the nation you go into, everyone's going to be masked.
You know,
when you said that,
masking. When you said that, here's the first thought that came to my mind. If you were going in for surgery, would you want your surgical team walking in without masks on when they get ready to cut you open?
Right.
And I was like, now that makes sense to me. That's probably not a good idea.
So everyone in our facilities masked, down from visitors, if we have anyone that is allowed, visitors, our ancillary staff, even if you're not patient-facing or you don't have patient interaction, you're still required to wear a mask. If you are patient-facing, we also wear eye protection, not glasses, but goggles, face shield. So those are things to expect to see your medical team wearing.
Now, is there risk of that transmission through your eyes?
There is, because you have mucous membranes that the viral particles can also get into your eyes. And so we require all of our medical team to wear eye protection.
Well, I've heard if you have a whole face mask on, because they make them now with a face mask, that you don't need the regular mask. Is that true? Or is it better to do both?
You do both.
Better to do both.
You do both.
I'm just checking.
So
I'm asking because there's people on they're wanting to know.
I do. And no, do you need a face shield when you go into Walmart? No.
You need blinders when you go into Walmart.
I don't wear a face shield other than at work if I was patient facing.
Yeah, I get it. Well, there's been so much of the narrative that's going on right now is like there's more cases, and it makes people feel like that, man, we're just being overrun. Do you see, either one of you, Abby or Pamela, do you see this really massive increase in cases, or would it be as a result maybe of testing, or is it a blend? What could you speak to that?
I think it's a blend.
Okay.
But she's the
Can you give me a percentage?
Cow.
Can you give me a percentage? And you don't have to be accurate, but from what you're seeing, is it 60-40, 80-20, 50-50?
I think as far as testing, yes, we've seen a definite spike and increased in cases. Is that because of testing? I think there's actually probably 10 to 15 times more cases out there than we actually know about.
Okay.
And I think that is because, if you have mild symptoms, you're probably not going to go to get tested. And so, especially since, I hear a bunch that people don't agree with the testing numbers, that, people are getting multiple tests, and so that's inflating our numbers. And that is definitely not true in North Carolina, because all of the numbers are what's called deduplicated. So all of our numbers, all of the public health nurses input when they do their contact tracing and their investigation, it is lab confirmed cases. So you have to have a positive lab in order to be counted as a case. That case is then entered into North Carolina Electronic Disease Surveillance System. That electronic system deduplicates those numbers. So it looks at all the positives. It looks at their demographics, their date of birth. It catches those that may be duplicates, and it removes those. So, it's not multiple cases being counted. If anything, we think that it's underreported instead of overreported.
Okay. You hear a lot, again, there's a lot of conspiracy theories out there, and that's what we're trying to kind of dispel, is to have good information. And there's a lot that said, if anybody dies in North Carolina, they died of COVID. So that's kind of what you hear people say. And I don't know if that's true or not, but that's what you hear. So you feel that whenever we're testing, that we're doing as good a job as we can. And there's always room for things to slip through the cracks, always. I mean, that's just the way that life is. But do you see, I don't know what our numbers are today. North Carolina has been sort of plateaued, not plateaued low, but plateaued up here. Do we have an angle we're going right now? Are we going higher? Are we going lower? Are we plateaued? What are we doing?
We are. We're not coming down yet.
Okay.
So, there are times where we stay consistently high and, but we're still going up.
Okay.
So for now, we've had over 1,700, almost 1,800 deaths in North Carolina. And our case definition is COVID-associated death. It is the same case definition that we've always used for influenza. So our influenza deaths has the same case definition, meaning that they were positive for COVID. COVID contributed to their death. We know there's so much to know about COVID, but we know that it doesn't just affect us respiratory. It's not just a respiratory illness. We've had increased CVAs or strokes, blood clots. It affects the small vessel. It affects the large vessels. So it's caused immune responses. So the more we learn about this novel virus, it's easy to see why it's a COVID-associated death.
Okay.
So yes, now if you come in and I've heard they've died of a car accident, but they were found to be COVID, and I do all of the death reporting for our facility, and so yes, that person had COVID, but they did not have anything that contributed to their death. So no.
Okay.
That doesn't count. That's good to know because I've heard that too.
Yeah.
Well, that's why we're here. It's to cut through the lies and to go to the source.
Yeah,
and
I
find
just
the
want to
truth.
hear what you're seeing, what you're actually seeing, so that it's not a guess or something like that. And again, I think anytime when somebody hears, even when you start talking about this, it starts to build fear into a person. And so you guys are actually in the hospital. You are in the place where people who would have it come. And the people who have the sickest are the ones that are showing up where you're at, and especially kind of where you're at, Abby, in those arenas. I don't think that you've actually gone in to some of the rooms yet. But
I have not been in with a positive COVID. The area I work, we don't take those type of patients. Now, I have had 3, I believe, that have recovered from COVID and have tested negative and are left with other, health issues because of that. A lot of blood clottings, things like that still going on that we are working with. So they're left with the after effects.
So I guess from your point of view, though, because both of you work in the hospital, so it's not like you can avoid it. It's coming to where you're at. But you two have not had it. Is that fair to say? Okay.
No.
So if you haven't had it and you're in the hospital, for all the people that are listening that might be like, oh my gosh, we should be so fearful. But you obviously mask up, you obviously wash your hands, you obviously social distance out there, and you're safe, right?
You strip in your garage before you go in your house.
Okay. Okay.
Yes.
Well, we'll leave that to somewhere else, but I understand what you're saying.
And I can tell you that we haven't had a lot of healthcare workers that have tested positive, but we haven't been absent of healthcare workers testing positive. They're out in the community too.
Sure.
So they're being exposed out in the community if they're not doing what we preach as far as prevention. But I can tell you from doing contact tracing that we had positives that they did not know where they were exposed from. So they had what's called no known exposure. And so the positives that we were seeing didn't know who they came in contact with, or either they had traveled. So they were travel related. And then our positives, we started seeing, oh yes, my nephew tested positive or my best friend tested positive. So they knew who they were coming in contact with. Now we're starting to see it's my family member or my direct household. So the circle
Right.
is closing in and getting smaller. And so that's because it's widespread in my community. But I encourage you to not just look at the numbers and, keep looking at that. I encourage you to look at hospitalizations, because that's what we look at. Because if you're sick enough and you can't breathe, that's what we pay attention to, is the number of hospitalizations. For New Hanover Regional, we're very transparent now with our numbers. You can go on our website. Our numbers are posted weekly. And so every Friday by 12 noon, we post our numbers for the week. And so for this week's numbers, we have 46 that are hospitalized. Those are 46 patients that are COVID positive, lab reported. They've tested positive, and they are in the hospital for COVID. Now, that is what is on isolation, what is utilizing PPE. We do have other numbers that are not included in that they've recovered, but they still have, they still need hospitalization. So they're no longer on isolation. They're no longer considered contagious, but they can't go home because they're hospitalized. And we've had patients that have been in the hospital for over 60 days with COVID.
I think that what I wanted to make sure that people heard, though, was I had two healthcare professionals sitting in front of me that are in the hospital regularly, week in and week out, and have not contracted it, where many COVID patients are, because they take the precautions that are necessary. So for the person that's sitting out here, if we take precautions that are necessary, we would be able to greatly mitigate our chances of getting it. Doesn't mean we won't, but you can greatly mitigate it, which means, especially when I hear about it, it's mostly, hey, went to a family reunion, we got into a big crowd, and we didn't think it was a big deal because they're family friends or something like that, and that's usually probably whenever it happens.
Yeah. Well, even in my family, and again, Kathy and Jimmy Watson are my parents. If you know Kathy and Jimmy Watson, Mama is hugging.
Yes, ma'am, she is.
We're very close family. We eat together. We go to Mom and Dad's. All of us, my sister Kim and Savannah and Alex Baltziger. Savannah's on the praise team.
Yep.
They're like my son's brother and sister. I mean, we're very close, but we wear a mask in my mom and dad's home. We have yet to be within 6 feet of them to where we're not masking. So if we're not eating, we have a mask on.
Yeah.
And that's with my family. And I know where they go. I know that they're protective. But if I was to give that to them, how would I live with that?
Yeah, I would go see my mother every Monday. I eat lunch with my mother, an extended lunch every Monday. I haven't eaten with her or really seen her in about 4 months. It's been a real challenge.
Really?
Well, my mom is 79,
Yeah.
and you don't want to do something that would be problematic.
We didn't at first either. And then we do see my parents. We don't hug, and we socially distance, wash your hands, and all that stuff. So, but we do.
Well,
still
one of
get
my
together
challenges
weekly.
is here, like if something came into the office and the church gets shut down.
Right.
So I've actually sent home several of my staff members in quarantine that I heard they were around somebody who got it or might have it or was tested, and we just send them home. We immediately send them home so that it doesn't travel through the office.
I was
That's
right
been
at
a
the
little-
very beginning of that.
Worth was one of the very first people that we sent home. His brother, which we don't know if he had it or not, but I think he probably did. Anyway, so we had to send Worth home, and that was the worst 2 weeks for him. And I told him, he said, hey, today's day 14. Can I come back? I said, at 5 o'clock, whenever, it's the full 24 hours. So he sat in the parking lot for that.
I did. I was in the parking lot at 4:45 waiting.
And I've sent Holly home, and I've sent Elliot home.
In
and
my
I've
defense,
sent,
that was the first week that we moved to the Life Center.
sent Lauren home. I mean,
Well,
it's just
and that's
everybody's
very
home.
responsible. And and that is recommendation. If you are, if you've been exposed, to stay home for 14 days, because that is the incubation period of the time from exposure to the time where you're going to develop disease or show symptoms within that 14 period.
And it varies in that
period.
14 days.
It does. And so But just the power of masking, I'm sure you may have seen it on the news, but there was one study from Missouri, and it actually involved two hairstylists, and they both were tested positive for COVID. They continued to work not knowing that they had COVID. They one had allergies, was very symptomatic, but thought she was having allergies. And so she did go get tested, but she continued to work waiting on her test because it was a long turnaround time. Ended up, she did have COVID. So just between those two stylists, they exposed 139 clients during that time period. But everybody wore masks, but they were close contact. I mean, cutting hair, doing perms, shampooing, they were in close contact. No one contracted COVID from those two because everyone was wearing masks.
Well, that's a good plug for that.
Yeah.
Okay, I want to ask you a really hard question, both of you.
All right.
Whatever your answers is okay. It's okay. This is going to be a personal question, but I know that they're working very diligently on a vaccine. And it seems like it's a race for space almost, because whoever comes up with the vaccine is going to be billionaires, whether it's China or the United States or Germany or whomever is working on it. Could be Israel, who knows. But when a vaccine becomes available, from your perspective in the healthcare community, do you think it'll be safe, and would you take it? Would you receive the vaccine? There might be some conflicting answers on this one, Martha, aren't there?
Well, I mean, hopefully it'll be safe, if they go through all the...
I guess the question is, we're pushing so hard and so fast. Are we going to skip something and we're not going to realize that it's not safe until later on down the road, which I think is a possibility for anything. But
I will probably take it. I don't know that I want to be the first one to take it. I'm going to be honest with you. I have coworkers that are in the testing of it now that are taking the vaccine.
Okay.
So kudos to them. But I'm even like that with the flu vaccine. I never get the first round of them that come out. I wait. Just me.
That's
But
okay.
yeah. So.
That's okay. How about you, Pamela?
I'm very pro-vaccine.
Okay.
I don't mind throwing that out there. I'm actually influenza chair at the hospital for our employee vaccinations. But as far as, you've heard vaccine Operation Warp Speed, that the federal government is pushing manufacturers to develop a vaccine. I really do not feel that they are compromising the safety and the scientific integrity of vaccine development. I think the Operation Warp Speed is more of the production end of how it's going to be mass produced, how it's, we're going to get it out to the general public. I don't think we're going to see a vaccine this year.
Okay.
That's my personal opinion. If we do, then it's not going to be widely available, I don't think, for the general public.
Okay.
In the sense that, I know how long it takes us to even get the flu vaccine to the general public. I think there's a lot of logistics, who your priority population's going to be, where are you going to give it, how you're going to get it in, the ordering process of it, the delivery of it, max vaccination events. That there's a lot to work out. And so, but I'm very pro-vaccine.
And is the research showing that COVID is the type of disease that you get one vaccine and you'll never get it? Or is it something that you're going to have to take a vaccine every year as it mutates or anything like that?
We don't know yet. And right now there's 3 vaccines that are showing promising results. But the manufacturers are trying to develop the parts of the vaccine to, you may have heard of, mutations, or people are saying, how can you develop a vaccine if you're concerned of it mutating or changing? So manufacturers are trying to develop the vaccine of parts of the virus that are conserved or that aren't likely to mutate significantly. And so don't know how long that immunity from the vaccine is going to last. Don't know how many you're going to don't know how far it's to be spaced apart. Right now, it's being tested in small numbers. And so with any vaccine or any medication, clinical trials or large studies are needed in order to see that. The number one side effect right now is a fever from those promising vaccines. I certainly would take a fever a day or two if I could have immunity from COVID and decrease my chances of getting COVID. That's a very mild
So if I get
illness.
COVID and recover, we pray that I would recover. Do I now have an immunity or do I not have an immunity?
We don't know that.
We
either.
don't know.
We
Okay.
don't know. CDC is saying that studies are showing now that you can at least have those antibodies for at least 3 months, but we don't know.
Okay.
And it's kind of based on the viral load that you have. We are seeing, or they are seeing, that sicker patients can have longer antibodies to that because they had, they were really ill, but we don't know how long. And obviously with a novel virus, it hasn't been around enough to see how long.
Okay. So some of those answers we don't fully understand things too. Okay. That makes sense. We hear, I'm just going to give you one of these things because I think people say it and they want an answer to it. That there's a lot of people that are not pro-vaccine. And I don't think that it's necessarily vaccine as much as it is trust. When you are expected to trust the medical community, trust the government, but you have people that are in office that are less than trustworthy. And when I say that, I mean they say one thing today and they say something totally different tomorrow, and then the next day it's different, the next day it's different. It's hard to trust whenever there's changing positions, not changing information, but changing positions. And that position change seems to be public opinion promoted as opposed to scientifically promoted or something like that. So there is this thought out there, this conspiracy theory out there, that if nobody will take the vaccine, they'll just stick it in a flu shot, and then everybody's going to get a vaccine anyway. What would you say to that? Either one of you.
I don't think they would do that.
That wouldn't happen. That is unethical.
Yeah. There's enough
and
people.
no.
There's enough things in place that
Well, we're not
even
saying
if
that
one
now.
person thought it, they're not gonna let that happen.
So I don't think they would do that either. But people say that, and I totally understand why they would say that. And even whenever we use terminologies like it's unethical or something like that, I'm not sure that ethics has anything to do with the United States anymore. I mean, I really don't. We have no ethics in our leadership areas. I'm not going to say that across the board as far as Americans are concerned, because I think that Americans are overall ethical people, very ethical people. But we have some people in the political arena that are less than ethical, and I think that their testimony shares that. So I'm not sure that an ethical stand would convince anybody. Whether it may be true or not, I don't know if it would convince them. So let's move to a financial position, because money runs everything, and that's what most people are concerned about. What do you think, and you may not have an answer for it, what do you think would be the financial fallout of a lawsuit if something like that were to come about for an entire community that we've immunized all these people against their will? What would that look like?
Sure.
I mean, financially.
Very detrimental.
It would be devastating to the medical community here, and then you would lose all trust in the medical community across the board if something like that would happen. And I don't think that they have time to be doing that. They're trying to figure out how to see if they can stop this thing, I think.
Well, and you
I
brought up
hope.
politics, and I think well, if you step back and you look, and if you had a chronic illness, what would you do? You would rely on your medical professional
Yes.
to tell you about it, to tell you how you got it, what we can do for it, what treatment modalities there are, and ways that you might, if it's a communicable disease, to spread it to others. So you would rely on your medical professionals or your trusted people that you've relied on that have been reliable. And, but we have people that are relying on the media
Yes.
for their information. And
There's the mistake right there.
That's a huge mistake, and it's totally backwards. You wouldn't do that for a chronic illness. Why are you doing it for COVID?
That's a good point. You wouldn't call it the news and ask them, how am I doing in my health care?
Exactly.
Right? You wouldn't do that. That's a great perspective right there. So hopefully everybody that's listening would take time to listen to their doctors.
And I think one thing you said too that I think people need to remember, and it kind of goes back to what Tasha said here, is that you said a medical professional, but then you added that you trust, someone that has been trustworthy. And I think that that disclaimer is important there, because I do think that there have been, in our nation, some issues with medical professionals not being trustworthy. And I think what you said there was really important. You're listening to these people that you've been with for a long time, and you can trust them.
Right.
Well, I think that
Tasha says some medical professionals have proven to be unethical numerous times, so that bucket doesn't hold water for me. And I can totally empathize for that.
Yeah.
But find that medical professional that you do trust, that has proven to
I think that's such a good word, because I speak to people in our church all the time, and I try to be ethical in how I speak to them, because I have been in the medical community for so long. My wife worked for OBGYN when we first were married, and she worked there for over 20 years. And so I've been in the medical realm, and then becoming a pastor, you're just at the hospital all the time. So I've been in that community for such an incredibly long period of time. And I'm not what I would call the greatest advocate for doctors. I've never been a great fan, not of the people and not of the profession, but just I was wish I never had to go to the doctor. You know what I mean?
I don't blame you.
I kind of get that. But at the same time, when I speak to certain people in our church and I find that there's a doctor that's, especially surgeons, I think are the ones that I really try to steer people towards what I would consider the people that do it once, not 2 or 3 times. And sometimes people won't change. They're like, no, they won't let me go to another doctor. It's like, no, you have
right.
permission and even responsibility to find a good medical professional. And I would tell you, most of them are excellent. Most of them are. Every now and again, there's people in every profession that are less than what we would desire. But I would hope that people that are listening would realize your medical care is your responsibility. It's yours. And so if you have somebody you don't trust, you're going to need to go find somebody that you do. And you might ruffle a few feathers here or there, but and if you ask for a second opinion or something, that can be a little bit of a challenge, but still it's your responsibility.
Well, while we're on that subject too, I would encourage people to look at their own health, the comorbidities we mentioned. If you need to lose weight, take this time, lose 10 pounds. If you,
I've lost 30.
There you go. You look great.
I can't believe how great you look.
Quarantine has been tough. It has been tough.
It has.
But if you have diabetes, and if it's especially type 2, and it's something you can work on. I mean, so many things we could all be working on ourselves to improve our health and our bodies. And also, I would encourage, this might be another session, another time, but to talk to your families about your health care, what your wishes are, especially if you're older and are having health issues. Talk about end-of-life things, because it's going to happen one day.
It is.
And there's things that, especially with families not being allowed to be on the inside right now, trying to solve these things over the phone and through case managers and things, it's very hard. And
it is. Rob Strickland has held, our pastoral care minister, he has held numerous little meetings with people, and he has been able to sit down with some and make end-of-life plans for them, all the way down to preparing what their messages were going to be that they wanted at their funeral services and things like that. And it sounds morbid when you're talking about it when we're alive.
You have to.
But at the time, there's nothing more comforting than to be able to say, we're doing this because that's what Mama wanted, and that's the way that it is.
Right.
And it takes the pressure off of everybody. And so it's, I told my son, I said, I'm going to lay out my things. He said, Dad, the only thing I'm concerned about is what's your bank account number? He's kidding, of course. But,
you think?
Well, he's already got everything I got. He's getting everything I have anyway.
Well, and if
But-
you're, if your family is not super close, if you haven't talked to a brother or a sister in a while, reach out to them and talk to them, see where they are and how they're doing, and talk about your parents. And
Yeah.
I mean, it's ultimately going to be, everybody's
Well, I
going to be pulled
I
together.
got another question for you because this is very relevant. Last week, we talked to a couple of ladies that we're talking about school coming back in. And so the big deal about school is, what is COVID doing in the school system? So whenever it comes to children, are they little petri dishes walking around? Are they going to infect all of us as they go back to school? Are we going to end up quarantining classroom after classroom and sending teachers? Is this going to be a fiasco when this all goes back? What are the challenges and risks for our children?
You go ahead, because I know you know.
No, I don't know, and I don't think anyone really knows. I think in order to bring schools back safely, our governor has given plans B and C, which are online or rotating.
Right.
And I'm not even sure if New Hanover County, I think they were supposed to make that decision.
I think they went to Plan C.
They did go to Plan C.
Yeah, which was online for the first
Okay.
6 or 9 weeks or something like
And
that.
so I think, yes, it can be done, but they have to be flexible in order and have things in place to minimize the risks, but also to be able to slam that button down to roll things back. And so, yes, you can do it safely. There's other countries that have done it safely. And so CDC has put out guidelines. I know it's very controversial. I know there's some, parents that there's a fear factor for both teachers and parents, and I totally understand that. But I also, think there's things, busing's going to be different. You have special needs children. The law says that, you have to take care of them the same. People are going to homeschool and neighborhoods and churches and co-ops where parents will trade off. But I also have concerns about those because, you're 6 or 7 kids close together in these settings. If you take that step to put your children in that, you have to make sure that wherever you're putting them also keeps the same CDC school recommendations.
Right.
So there's still social distancing, there's still masking. One thing about schools is it's easy to quarantine and contact trace when you know those children that are in the classroom. We do it all the time. You have a pertussis outbreak, and you know what children need to be quarantined, or what's called chemoprophylaxis. So you know what children need that medicine or need to stay home for that exposure. And so if you're not keeping them together in the classroom, and you're putting your child here or putting your child there, you're expanding their exposure.
Right.
And so
We had a few questions
Okay.
online, and one of them is right in line with kind of what we're talking
Okay.
about. It's from Jennifer Costa. She said, Pam, can you speak to the differences in transmission rates between younger children under 10 and older students?
certainly. So she says 10, and that's been the cutoff or what has been shown in the evidence. So the younger the age, the less infectious or the ideal for spread. So they're not able to spread it as much. It's thought of. They have lower viral loads is what that is called. Older than 10, we've seen that they can pretty much spread like an adult. So a teenager, a high schooler, middle schooler can spread just like you and I could if we were infectious.
So is the greater concern their ability to spread because they don't seem to be affected as much by the virus? Is that still true, that they don't have the same incidence of challenge with it?
Well, we've seen lower incidences in kids and lower deaths in kids. So, we've had 36, 37 deaths of children. Even one death is
Is that
too
nationwide?
much.
That's nationwide.
Okay.
Uh-huh.
Okay.
Even one death is too much.
Sure.
But when you look at the incidence in compared to adults, yes, it is much lower. But we're also, have seen rare instances of what's MISC, which is multi-inflammation syndrome in children. And so those are, rare occurrences, but we have had those in children. We've had them locally. And so
were there other comorbidities in those kids that
no,
contributed to that?
No,
Just
they've
healthy?
been healthy kids.
Okay.
But kids can turn on a dime. So, they can be healthy and get the virus, and then, 3-4 weeks later, they have this post-inflammation syndrome where they just crash. And so that phenomenon is in healthy kids. It's not just respiratory, but it affects them. And so recognizing if your child does get COVID, that they need to be concerned of some post events that could occur and be mindful, because, you can treat shock, you can treat anti-inflammatory illness, but you have to get them, care.
What's the indicator
soon.
of those post-exposure things? Is there I feel bad, I got a fever,
Well, it's just like any other, difficulties breathing, confusion, circulatory problems, turning blue, all of those.
Do they also get a rash?
If
Is
they
that the one
turn
that
blue.
they were showing the rash on the kids too?
Okay.
Yeah, but not all have.
And so what
developed
do you do as a
rash.
parent? What do you do if you were to start? Do you take them to the hospital? Do you?
Absolutely. In
Okay.
those cases, absolutely.
Okay.
That's an EMS call
Oh,
for
okay.
those.
Okay.
But again, those are very rare events. And so, but children can get COVID, but we don't know how they can spread it. It's in the sense that for tuberculosis, we have a really young child that develops tuberculosis, and they're not thought to be able to spread it as much as
Right.
an adult can.
So we are definitely kind of nearing the end of our time, but there are a few questions that I definitely want to get to that people have asked. There's two specifically that I want to go back and talk about. One of them is from Tanis Boswell. She said, "Can we go back to masks?" She said, "Can you explain why they seem to only work in one direction? Meaning that if you're not wearing one, but I am, why do I need to be concerned for myself if I have a mask on?" And she says this is kind of confusing. So can you kind of go back a little bit to kind of the purpose of the mask in terms of protecting yourself versus protecting others around you, and just kind of give a little bit of clarification for that?
Yeah, so I think she's asking, if the source person is masked, why do I need to wear a mask? Is that
Yeah, I
what
think
you're getting?
both ways.
I think both ways.
Mhm.
Yeah,
Okay.
look at it from both ways.
okay? So masks aren't 100%. So certainly if you have a mask on and you're the source person and I'm not wearing a mask, yes, I have decreased transmission, but it's still not 100%. So if I wear a mask and you wear a mask, that totally increases my incidence or my risk for that transmission.
Exponentially, it goes up pretty high.
Absolutely.
Yeah,
So
so
does that?
yeah, I think that's
that what
I
she's
think I
asking?
think that's pretty much
Okay.
what she's asking,
I
because
hope
it's
so.
like, if you're the sick person and you cough, then you catch everything in your mask, but that doesn't mean that you catch everything. It could still get around or something like that. So whenever you double protect, you're just adding an extra layer of protection.
Right.
So
So even in the hospital, and there, we're wearing, our COVID unit is wearing either N95s, which are, filtered masks, or even the cappers. We will still put a mask on the patient in the hospital.
okay.
So
All right, another question, which is kind of goes in a different direction, but it's from Alex Mercer. I'm not going to go through all the details of the question, but basically what he's saying is that, or what he's asking is, how long do you anticipate this continuing? And I know you probably don't have an answer, but just your most educated guess that you could give to how long you could see potentially even another nationwide shutdown. Is that something that could be in the works? And then, what could we do to prevent that from happening?
well, it's a virus, so it needs a host, in order to continue. So if we do what we're supposed to of social distancing, wearing masks, we could substantially decrease our incidence in our community. And so things could open back up fully. But I personally do not feel that if we put off schools 9 weeks, that we're going to see any different in those 9 weeks.
I would agree.
So, so to answer his question, it's all up to us.
Mm-hmm.
So it's up to how well we take precautionary measures and do the things that we're supposed to in order to squelch out the virus.
In other words, personal responsibility for yourself and a concern for your fellow man or woman. I think is really where it's at.
I think we can come and do school safely, but again, being able to hit that big red button, I don't think and see that athletics would happen as quickly if we brought schools back. Certainly, it depends on how tolerant you are to have positives on that team. But certainly, if you have your entire pitching your pitching staff on your team of your baseball team gets a positive, what are you going to do?
Yeah.
How
it's
how
kind
are
of the
you
same
gonna
thing
play
here.
that
When we look at in here, what would happen if if one of us got it and we're actually walking around the staff,
Right.
because we're here. We've been here every day, and I've been very careful and also proactive. In the minute that I hear something like, "Are you sending me home?" Yes, go home, and it has worked. That's a good thing. We're still moving along, but that's. I think that Alex's question goes beyond the medical question all the way into more. He's in the insurance industry, and they're predicting that it could go 18, 24 months for a shutdown. I personally don't see that happening. I don't think that there's a point where there's a tipping point where you have to weigh and measure the cause and the cure. At some point it's going to be, you can't shut down the world. You can't just close down everything. And there are countries that are being extremely effective at handling this. I think that we haven't taken advantage of some of what they're doing yet, and that'll come along a little bit further. I don't see it happening that long. In fact, with our current president, he's not going to shut this country down again, no matter what. So
we have to learn to coexist with
we
it.
do. I think that it's a time whenever we have to recognize that the government is not here to diaper us.
Right.
We're grown people, and we need to take responsibility for our life and the life of our community around us and be responsible. I think that's what we have to do.
I want to make sure that we bring up, I've had multiple people, including Miss Kim, bring up that there has been no definitive decision about Plan B or Plan C at this point.
Thank you, Kim.
So just wanted to go ahead and make sure that we said that live. Tuesday, it looks like, is the day. I do have. Do what? Go ahead.
Hey, my mom. Can I just say this real quick? I see that my mom is watching, and I want to say, hey, Mom, it's good to see you. I miss you. And by the way, Mom, I want to tell you, I'm coming back to see you tomorrow. I'm coming for lunch tomorrow. Just don't cook me any lunch, but I'll be there to see you.
Well, that's the thing, we don't know what tomorrow holds. And if we're not loving each other and taking care of each other, the last thing you'd want to know is that you didn't go see your mom or get to talk to her and something happened to you.
Terry and I talked about this because, Terry's got a suppression and takes medication for it and things like that. So her medication is hydrochloroquine. So I don't know if that helps any or not. And she's O negative. So I've heard that there's an issue of blood types. I don't know if it's true or not. But in her blood type, she's maybe less risked.
Right.
I'm on the high risk side. So.
And I'd like to tell people too, we shut down in the beginning. The hospitals were empty. We were twiddling our thumbs. We got in trouble financially, kind of, sort of,
right.
Shutting everything down. And it's okay to come to the hospital if you're sick. If you're having issues, not just COVID, come to the hospital. Don't wait.
You need to come. Yeah.
Because, then you're putting your health at risk.
And you guys have divided the hospital up enough where there's safe zones for people with no COVID, and then they got people in different places.
Yes.
So that's important, I think, for people to know. Some are afraid to go to the hospital.
Yeah.
Yeah, like I said, we've converted entire units to COVID. So, you're not going to be on the same floor as our COVID units. And yes, again, all of our healthcare workers you're protected with them masking and their face shields. So you are protected from them too. But one more thing about the schools is I know with Reed, and he's a college student,
Mm-hmm.
and so that decision has been made. And so he will be going back to Greenville on August the 10th. They'll be splitting the semester into 2 parts. So if he has 6 classes, he'll do 8 weeks, 3 classes, and 8 weeks, then the next 3. So, and that premises that they're exposing you to fewer kids in that 8 weeks instead of all 6 classes in
But
the
he won't
semester.
be playing ball though, will he?
He will not.
Yeah.
He will not. And
That's a challenge.
and they will finish up the semester by Thanksgiving, and then he'll
Yes.
come home.
Okay.
So
I hate he's not playing ball, but I understand. And he
Yes.
probably does too. And so do you guys, because he's an incredible ball
I
player.
know. I missed it.
Absolutely
I
incredible
miss
ball
it.
player.
He's played ball since he was 3-year-old at T-ball, so I do miss it.
We have multiple people writing in saying thank you for keeping us updated, to the two of you specifically.
Yes.
Annie Eastland said thank you, ladies, for the work that you're doing in our community. And of course, going back to our healthcare workers are absolute heroes in our community for the work that they're doing through all of this. And so one of the last questions that I have for you guys is, what can we do most effectively as a church and as a community to support our healthcare workers? I know that, as a church, we probably can't head out to the hospital with a basket of food and drop it off, So what are the things that we can do, whether it's tangible, whether it's intangible, that we can do to really support our healthcare workers?
I would say for the bedside, write notes, send them. You could send them to me, and I'll get them to the people, or just send them to the hospital. And I asked one of them this the other day. They said little coffee gift cards or Chick-fil-A gift cards, anything to just kind of boost their spirits and let them know that the community is thinking about us, and to also, wash your hands, wear your mask, socially distance, and
You want us to stay healthy,
Stay
number
healthy.
one.
Yeah.
We
That's
appreciate
right.
that. But when you're out there pulling a double, triple shift, whatever it is. And so Northside says, you know what, we want to, in some way, say, not only do we support you, but we want to help to support what you're doing out there. So as a church, what can Northside do? I mean, we can't do it for everybody. I understand that. But if everybody did something, then it would kind of come across. If there was one thing you said, boy, I'll tell you what, our nursing staff or our medical staff or whomever, our administrative staff, this would make a difference for us if somebody did something like this, just an encouragement. You might not know. I don't know.
I don't know. We do have a resiliency program. So we do have a program that does provide things to staff. So, if anyone in the community was interested in giving, we've had gift bags, we've had gift cards, we've had food trucks that, the restaurants, they weren't able to be open, but we had, food trucks that would come and do meals. We can't have things delivered to the hospital yet, but, someone could go, we've had, somebody order pizzas and someone can go and pick them up and bring
Okay.
them in from the hospital. But as far as, I think what you have done, Pastor, lots of churches opened up immediately, despite the governor's executive orders. I think you've been a great leader for the community
Thank
to
you.
show what, being responsible. And so the community members doing what they're supposed to in masking, and it's frustrating for us when we're putting in such long hours and we are so dedicated, and then to hear the backlash and to see the backlash on social media and the back and forth of masking. Yes, you can have your opinion, and you're certainly entitled to do your own research, but I think before you press send when you're typing on social media, for the community to think, okay, who might be seeing that and how am I going to impact that person or change that person, and that may be putting that person at risk, and they may be exposing their family or their loved ones. We certainly have seen at the hospital where entire families have succumbed to this illness. We've had a mother and a daughter pass away in our hospital. So I think we have to take responsibility for what we give, the advice that we give, and make sure that it's sound. I've disclaimed that I'm not representing New Hanover Regional, but the views that I have, I feel strongly for, just like you would feel strongly for yours. But just making sure that what we are giving as advice isn't going to do harm.
Right.
I think your sister sums it up right here perfectly in all caps. She said, personal responsibility and a concern for your fellow man. Wise words, Pastor. With 4 exclamation points.
That's what it's really all about. Well, know this, that we support you. We support both of you and all the medical community out there. I wouldn't want to be in that seat that you guys are in. I mean, a lot of people say, I wouldn't be in your chair any day of the week, Pastor. I was like, I wouldn't want anybody else sitting here. I mean, I wouldn't. I want to be the one to make those kind of decisions. And at the same time, I'm having, like I said, I'm going to have some eye surgery in a couple of weeks from now and then a couple of weeks after that. And I just really felt comfortable going into my eye doctor and discussing with her what was going to happen and where I was going to be and what they were going to do. And then having Faith Perez as my care nurse, I know she's going to take really good care of me. And so I don't feel that there's any reason for me to have concern about having my eyes taken care of. Because I have such faith in the medical community, and I think that you guys have done an amazing job, and I appreciate what you do. If there is things that we could do to encourage, help, feed, whatever, that's within our capability, certainly this church always wants to be at the ready to be able to do that, because we want to be at the forefront. I feel like that churches should be a bonus to being in the community, that there's a reason that we're here, and I'm a pretty stringent preacher. My opinions are not light. They're pretty in front. And at the same time, they're always for the benefit of everybody around me. And we want to make that not just preaching. We want to do that by hands and feet as well. Mm-hmm. So for either one of you, if there's ever anything that we can do, and even, what'd you call that you guys have?
Resiliency.
Resiliency.
Is there a
contact? Is there a contact or something that
I can get that?
Okay, yeah, if you could get that
David
to us.
Long at the hospital.
Because
Absolutely.
sometimes if you can go through a particular organization or a single point, and then they get to decide, here's the best way to use it, and that's their decisions. That's fine with us. But, because I think you would probably obviously trust this person.
Absolutely.
To say, hey, here, whatever you think is going to encourage your people is what we want to do with that.
All right. Well, again, let me say thank you both for being here. This has been a very important conversation for our church and for our community. I hope that it continues and spurs more conversation in families tonight as we're kind of talking and unpacking all this information. But it is definitely time for us to wrap up. Please know that this video will stay on our Facebook page. So for everyone watching right now, if you'd like to continue.
Y'all talk about my preaching and how long I take.
Yeah, I'm sorry.
I do take a long time.
Yeah, you do. It's fun. But this video will stay on Facebook, and so we can continue the conversation here in the comments as well. But Pastor, I want to ask if you would pray us out of here tonight.
Absolutely. Join me in prayer. Father, we are so grateful to be your children. It's one of the reasons that I have no fear. Fear is not an option. You did not give us a spirit of fear. In fact, you gave us something quite to the opposite. You gave us the spirit of love and the spirit of power and a sound mind. And what's so encouraging to be here tonight is to listen to 2 of these ladies in our church that are skilled, that are intelligent, that are committed to what they do. It is a privilege to be able to sit at the table with them and for them to inform me, to inform our church, to be a part of this. So thank you for that. And there's so many in our congregation, the ladies last week, that has such incredible input into our educational system. I thank you for that. And there's others that we will continue to resource this program with and try to help other people. But Lord, I do pray for our country. I pray that you would help us to heal in so many areas. We need to heal in the area of our relationships with one another. Such a challenge in terms of racial reconciliation, division, things like that. But Lord, I know that whenever you're involved in it, you can help us to find the road and the path that will lead us to a United States once again. I pray for our healthcare situation. This COVID virus has really taken us by storm, and a lot of business has ended, and as a result, there is other challenges out there in the medical community, psychiatric care, mental health, and things like that also need to be thought about. And I pray for all of our mental health care workers who are working with people who are really struggling right now. And Father, I pray that for our church that you'll continue to keep us strong, that you'll allow people to continue to support and give and be a part of us so that we can continue to be a benefit and a bonus to this community for having us here. And Lord, we thank you because you are our God, you are the Lord, you are in control. And because you're the keel that I talked about this morning as we found our life in the person and work of Jesus, and we establish our life in the faith of the whole counsel of the Word of God. We stand strong in this, and we are available to you to use us any way you want. Bless the listeners, bless our country, bless these folks that are here today. We thank you in Jesus' name. Amen.
Thank you, everyone, for tuning in. We will see you at the Northside Podcast next week.
God bless y'all. Thank you for being here.